Hello, East Brunswick. I wanted to give you this COVID update as news just came out today on the media that East Brunswick's Community Arts Center was selected by the county as a vaccination site that's going to be used for vaccinations of the COVID vaccine. But before I start on that, I do want to say that I'm taping this today on January 20th, which is Inauguration Day. The president about 20 minutes ago was just inaugurated, new vice president, and I wish them the most success possible, no different than I did 4 years ago. This is the United States of America. We're not the Democratic United States of America. We're not the Republican United States of America. We are the United States of America, and I hope that our president is extraordinarily successful, because if he or she is able to be successful, then the entire country is in better shape. And as an American and deeply patriotic to my country, like I'm sure all of you are, I only want what's best for this country. So I wish President Biden and Vice President Harris the most success possible in their new endeavor. But I did want to talk today about COVID. And first, a little bit of an update on numbers. I know that everybody periodically looks at the news or the county website. Right now, our East Brunswick numbers are totaling at about 2,200 cases. That puts us at about 11th in the county, and there's 25 townships in the county. But for townships our size, 50,000 or more, we are actually the lowest number of COVID cases in towns of that size. In terms of deaths, we're right now clocking in at 82 deaths. Among them were 38 that were at the long-term care facilities that we all know about, Care One, Sunrise, and Chelsea. The remainder occurred either at hospitals or at other types of long-term care facilities, but they are individuals that lived in East Brunswick, whether or not they passed away here. And of course, we mourn and condolences out to anybody who had to suffer a loss during this pandemic. As far as closures in the township, the administration building, as you know, remains closed. The public schools are closed. I'm sure you've all gotten your updates from Dr. Valesky. And our East Brunswick Public Library remains closed. This is all as a result of and due to the persistently high numbers of new cases that continue to get clocked in, the rising trend line in terms of the number of cases, and the high transmission rate in the community at large and in the state. We will continue to look at those numbers, each one of those organizations, as it gets to a place where we feel that it's safe to open, intend to do so. But we do need to see a sustainable drop in the number of cases in order to do that safely. As far as testing for COVID, it's not like it was back in the spring. We now have a lot more places that you can go to. There's private labs, there's private doctors' offices, and of course, Middlesex County is still providing free COVID testing. You just simply need to go onto the county website, identify what facility you want to go to, and you can actually book your appointment right online. For those that cannot access the internet or do not have family members who can help them with their computer skills, we are continuing to advise you to go to the county call-in center. The number is going to be provided below, but it's 732-745-3100. But I do want to get to the main meat of the business today, which is to talk about vaccines. And as everybody should know by now, the main problem with vaccines right now is supply. It's a problem nationally, it's a problem in the state, and consequently, since the county gets their supply from the state, it's an issue for the county as well. The county and the state, who are going to be administering all these vaccines, are, and only them, these are not being distributed by the township. So the mayor has no control over distribution of vaccines. But the county and the state will be following the CDC guidelines in terms of phasing vaccines. Currently, healthcare providers, which is Group 1A, long-term care residents and their staff, also 1A, first responders that are part of the 1B group, individuals at high risk, and the CDC defines what those high risks are, individuals over 65, And at that point, at this point, those are the individual groups that are allowed to get vaccinated. As we move forward, the next group will be people in Group 1B who are other frontline essential workers. Other essential workers will be Group 1C, and then it will eventually be opened up to the general public, which is Phase 2. So that phasing is going to be continuing. Right now, the county and the state have developed sites all over the state for vaccination. The county has its own registration site, but over the course of the next week, that site's going to be merged with the state registration site that most residents know about. If you don't, you are advised to register with the state vaccine site, www.covidvaccine.nj.gov. Once you've done that, you'll register. You'll provide your date of birth, all your demographic information, any medical problems that you have, and from that point, you'll be assigned a group number in terms of what group you're in. When and if your group is called, you'll get an email notification that your group's been called, and on that website will be all of the state sites and all of the county sites that you can log on to or click onto and then schedule an appointment if there's a slot that's open. So you'll be able to do all of that from the website. Whether it's a state site or a county site, they are open to anybody in the state. So you may find that the best slot or the most available appointment may not necessarily be in the facility that's closest to where you live. But you will be able to access that site from and directly from the state website. As most of you know, vaccines first became available in December 15th. That's when they were available to hospitals. They delivered those vaccines to paid and unpaid healthcare workers that are employed by each of the hospitals that were given the vaccines. Those are 1A people, and then by the 30th of December, the Federal Pharmacy Partnership was developed by the use of CVS and Walgreens under that federal program in order to provide vaccines for individuals that live in long-term care facilities. They started with nursing homes, again, 1A individuals that either live or work for a nursing home. As time progresses, the Walgreens and the CVSs will continue that process, but to other long-term care facilities, such as assisted living facilities and group homes and a congregate type of settings such as that. What it is not for is for communities that are designated as over 55 private communities. So the Waterford and other communities in town that are not congregate long-term care facilities would not be serviced by that program. Those individuals are going to have to go to the vaccination sites that are distributed throughout the state, whether they're run by the state or run by the county. By the first of the year, the state actually launched its website, and that's the covidvaccine.nj.gov. And at that time, they announced 6 mega centers that are going to be providing vaccination. The closest one for us is going to be at the New Jersey Convention and Expo Center in Raritan Center. That, once it reaches its peak capacity, will be able to vaccinate about 2,400 people a day, and it's going to be jointly operated by the Robert Wood Johnson Barnabas Health system, and they will be administering the vaccines at that site. But the vaccines they get are through the state. This is a state site. There's also other state sites, and if you go onto the website, you'll see them. Many of you have probably already heard that several ShopRites, like the one in East Brunswick, the one in Spotswood, Chandler Clinic in New Brunswick, Jewish Renaissance in Perth Amboy. Those are all additional sites, and you can access them as well through the state site. The county has also started launching vaccination centers. The first one that was vaccinated was in Sayreville at the Fire Academy. That's where they were vaccinating healthcare workers that do not have privileges at hospitals, the doctors that don't have privileges, dentists, chiropractors, physical therapists, all other type of healthcare workers and their staff, because they're considered 1A, but because they don't have privileges or are employed by a hospital, they couldn't get their vaccination through the hospital. They then added the ability to vaccinate essential workers in group 1B, so our police and our firefighters. Now they're opening up to the groups that I had mentioned earlier. That is administered through the county. And the other sites that just recently came on board included our Community Arts Center here in East Brunswick. But among the other sites that the county brought on and announced includes the Heldridge Hotel in New Brunswick, the Monroe Senior Center in Monroe, the Middlesex County Health Services Center in Piscataway, and the Middlesex County Votech in Perth Amboy. All of these sites are administered through either the county or the state, but the appointments for vaccination at any one of those sites, whether it's a county administered site or a state administered site, can be done through the state site. And you will be notified by email, as long as you've registered, when your group has been called, and you'll be able to access any one of those sites from the state site. Whether you get your vaccine at a state site, a state administered site, or a county administered site, you can come from anywhere in the state to get a vaccination, which means that just because we have a site identified in East Brunswick is not a guarantee that that is only accessible to people that live in East Brunswick or only people that live in Middlesex. All of these sites are open to anybody that lives in the state. Again, and I can't emphasize more, for those individuals who do not have internet access or elderly who may not have the computer or technology skills and have nobody who can help them get registered through any one of the state site, please contact the Middlesex County Call Center. That number again, 732-745-3100. They will help you to get registered, and if you need help, they will also help you with getting an appointment. But at this point in time, we're all in the same scenario. There's just simply been not enough vaccine coming to the state, and the state therefore doesn't have an ability to make sure that the counties get a regular supply on any regular enough schedule to be able to promise you that spots that are open will stay open. It's completely dependent on supply. As an example, Middlesex County to this date has only received 4,000 vaccines. They've distributed a little over 3,000 of them, but that's really a small number when you consider that 800,000 people live here in Middlesex County alone. So I understand how everybody is anxious and concerned and wants to get their loved ones and their mothers and fathers and seniors and people that have health conditions that do absolutely justify the need for vaccination, but we are going to have to be patient and try to access sites and locations as soon as you're notified that there's spots that are open, and not be afraid to travel a distance if the closest and earliest spot for you isn't necessarily the one that's the closest. And finally, the township did launch an initiative coordinated with the Health Advisory Council under the leadership of Dr. Ken Friedman, and with the East Brunswick Public Library with the help of our health information group led by Ms. Karen Parry. And what we did was put together a survey that we're asking East Brunswick residents to complete. Basically, we're asking whether or not you're interested in taking the vaccine. And if you're not interested in taking the vaccine, we'd like to try to figure out what those reasons are. And in addition, looking at some demographic information on your race, ethnicity, age, to try to determine if there are groups or pockets of people who really aren't interested in the vaccine or just need more information. What is it that we need to provide, and to whom do we need to provide that information so that you can make an individualized decision about whether or not you want to be vaccinated. But we'd like to target the right answers to the questions that are on your mind and to the right groups who are posing those questions so that we can use our resources most efficiently. But at the end of the day, we want our community to be safe. We want everybody to get back as quickly as possible to as normal a way of life as we were used to. And in order to do that, we really need to get vaccination levels up to a place where we can reach herd immunity. And for not only those who are getting the vaccines, but enough so that we could drop the transmission rate so that those who either choose not to or can't take vaccines are able to function in a way where they don't have to worry about getting COVID. And that only happens when enough of us participate. So with that said, I'm hoping that I can have more good news as more vaccination centers open. And I wish you all to stay well and to stay safe, and to please just hang on a little bit longer. I really do believe that the worst of this is behind us, and that the future is very bright.